Okay. Today we do cranial nerves. Then there are 12 pair of cranial nerve. Then first is olfactory nerve, then optic nerve, then oculomotor, then truncular nerve, then trigeminal nerve, abducens nerve, facial nerve, vestibulocochlear nerve, then glossopharyngeal nerve, then vagus nerve, accessory nerve, hypoglossal nerve. All the nerve are associated with an organ. Like olfactory is associated with kidney, optic nerve associated with the urine bladder, oculomotor nerve is associated with pericardium, trochlear nerve is associated with the heart, trigeminal nerve associated with the stomach, abducens nerve is associated with sangio, facial nerve is associated with small intestine, vestibular cochlear nerve is associated with spleen, glossopharyngeal nerve is associated with lungs, vagus nerve is associated with liver, accessory nerve is associated with gallbladder. Then hypoglossal nerve is associated with large intestine. Okay. So now I tell you the working of all the nerves. Then first is olfactory nasal cavity. It is responsible for smell sense. Then it is responsible for sinus problems. You can get it when you see there is nasal obstructions, sinus problem, rhinitis, sinusitis. All problems you can treat with this nerve. With this, if you find in neck diagnose or abdomen diagnose, you find kidney point is tender, then you can needle this point. Then optic nerve, second. Optic nerve is for vision problem. Then there is blurred vision, vision is not clear. Yeah. Then you can use optic nerve. This is associated with for diagnose urine bladder. Then third is oculomotor, ciliary muscles, sphincter's pupil, and all external eye muscles except those below. Uppers, all the muscles we can treat with this muscle, this nerve, with third nerve. Third nerve is associated with pericardium. Then fourth is trochlear nerve, superior oblique muscles. This is controlling our eyes, superior oblique muscles. So when there is any problem to see upward and downward, then you can use this nerve. This is associated with heart. Then fifth, trigeminal nerve, it is associated with stomach. Trigeminal have a sensory of face. There are three parts: ophthalmic, maxillary, and mandibular. So sinus, teeth, orbit, oral cavities, and dura matters problem you can solve with this nerve. Still we have to 5. Give me only 5 minutes. Please, you see. Uh, then, uh, then sixth cranial nerve is abducens nerve. It is responsible for lateral view, medial and lateral view. When you see a child and a patient with cataract eye, then you can use this point. It have very miraculable results for cataract eye. And for this muscle, you can see the diagnostic for triple Warmer point of diagnose area in neck and on uh, abdomen diagnose. You can use triple hitter and Sangio point. Then next is facial nerve. Seventh nerve is facial nerve. It is responsible for all the movements of muzzle of face, stapedius, posterior belly of digastric styloid, occipitalis, ocularis muscles. Then you use this muscle and it's diagnose for diagnose of this nerve. You can use small intestine. Then second is intermediate nerve with the submandibular, sublingual, lacrimal glands, taste, and third tongue sensory soft plates with this facial nerve. So I told you before also, this nerve is very important for deaf and dumb child. When there is a dumb child who have no voice, you can treat with this point. Then it is a very miracle results giving point for deaf and dumb. The next nerve is vestibular cochlear nerve. For cochlear nerve, it is responsible for hearing problems, and you can use it for a deaf patient. And this is with the attached with spleen point. It is attached with spleen point. Then there is glossopharyngeal nerve. It is responsible for taste, saliva extraction, sensory, tonsil, pharynx, middle ear, motor, stylopharynx, and parotid gland. So for a dumb child, you can use cranial nerve, even facial nerve, and glossopharyngeal nerve, both. And he also dumb. Almost diff and dumb both are together, then you can use 7, 8 and 9, all three nerves. Then next is most important nerve for our body, vagus nerve. Cranial nerve is vagus nerve. It is responsible for all the parasympathetic movements for all the organs. It treats heart, lungs, palpate, pharynx, larynx, trachea, bronchi, GI tract, sensory, heart, lungs, and GI and external ear. So it is very important for all the digestive problem, for all the muscle problem, for all the liver liver related problems. You can use this because it is belong with the liver, and liver is attached with the tendons. Our all the tendons are responsible with for all the movements, because tendon joint bones to bone. So it is very important muscle for all the patients. I only say one sentence. You remember this as you remember God. On every patient you use this point. Then next is accessory nerve. It is attached with the gallbladder point. Then it is working with the sternocleidomastoid and trapezius muscle. All neck problems like thyroid and speech disorders. In this, you can use this. Then hypoglossal muscle. It is responsible for tongue muscles, strap muscles, and fibers. It is joint with the large intestine. When there is a tender point on large intestine, you can use it. Now, if you have any misunderstanding with all the points and you are not understand with any one point, then please tell me. Hello? Hello?
Hello, Prof.
Yeah.
Yeah,
Everyone
this.
is understand with all the points. If anyone is not understand, then please ask.
Well understand, sir.
Okay.
Understood.
So we go for needling zone. So Dr. Anita, please share PDF file.
Okay, Prof.
121 page.
Prof, is this what you're saying?
Yes.
Okay, Prof.
Yeah. Then show only picture. Yeah, very clear. Yes. Okay. Now you see all the points location. All the points are started from 1 centimeter above the hairline, from where your cerebrum point is started, where A point is end and cerebrum point is started. From there, these all cranial nerves point are started lateral, 1 centimeter lateral to mid sagittal line, and go through coronal suture. Endpoint is coronal suture. Between these, you have 12 points from hairline to coronal suture. So all the points are here. All the points are dotted. When you find it with probe, then you use it. You are understand with all the point location. 1 centimeter from, all the points are starting from 1 centimeter above the hairline and 1 centimeter lateral to mid sagittal line. All the points are adjust with each one. If you want to cover all the points, then you use 4 needles. Put first needle, then second, then third, then fourth. When first needle is end, then start second, then third, then fourth, then fifth. And in this, you see the vagus nerve point. You see the vagus nerve point. This point is very, point number 10 in this, you see, yes. It is very important point for all type of body movements, all type of muscles, because it treat all the parasympathetic moments and all the deficiency of organs. It clear. There are two moments, sympathetic and parasympathetic. Parasympathetic is more important because they control the body's movement and control every organs. So this is very important point. Can we go for next? Ja. Next PPT. Ja. The function of cranial nerve. Diagnose and everything I told you. The function of the cranial nerve point is the same as that of the Y-spleen point. In addition, needling a cranial point, nerve point can extract an effect on that cranial nerve working. For example, trigeminal neuralgia is a chronic pain condition that affects cranial nerve 5, the trigeminal nerve, which innervates the stomach organ. Therefore, it is better to needle the cranial nerve point on the scalp than to needle the ST Y spleen point. It is also important to know the function of each cranial nerve. The next, stomach eye. The bilateral somatotope. This picture you can draw on bilateral on your head, on your patient side, which is located in the ear region, was recently developed from the eye basic point, contain an image of the entire body. You see, here is full body. Show only pictures, no problem. More bigger, yeah. Like this. So you see here, below the earlobe, there is head. Then on front side of the ear, there is cervical area. Then back, there is area of lumbar area. Then between, then on central line, you can see top of the ear apex, there is L1 to T12. L1 to T12. It start with the T1, then go with T12 and L1. Then back side there is leg, and on front side there is elbow. When you put 3 fingers, you see my palm. You put this area from where your finger is starting on top of your ear. Then front finger is represent your hand. Then middle is for your spine, and then back is for your knee problem. When you have problems on knee pain, then you can put needles here. It is a small body represents here. So which the somatotope, which is needle to treat problem of the musculoskeletal system, has 3 areas. The lumbar area, extremely area, which is extend along the mastoid bone and ascends to a height which is double the length of the ear. The diagnostic zone for this area is the medial epicondyle. Yesterday we show you on go for PPT 113. Dr. Anita, please go for 113.
113. 113.
You can stop here, no problem. Yes. You see here on middle area, there is lumbar area on epicondyle side. Then thoracic area. Yeah, then thoracic area, and then cervical area. You can see here for diagnose. You should diagnose here and put the needle on nearby area of ear. The thoracic area which is extend along the apex line and ascends to a height which is double the length of the ear region. Go for 123, no problem. Dr. Anita, please go for 123.
123.
Yeah. This area is only for diagnosed area. Yeah. Then thoracic area, which is extend along the apex line and ascends to a height which is double the length of the ear region. The highest point of this line marks the point where thoracic vertebra 12 and lumbar vertebra first meet. The diagnostic zone for this area is the digital area of LU5. On elbow diagnose, you see there is middle part of, there is thoracic area. Then cervical upper extremities area which extend from the notch where the ear and extend to a height which is double the length of the ear. The diagnostic zone for this area is lateral epicondyle. It is clear? You have to go for diagnose all the three areas for you go to elbow diagnose. Next picture. Ja. In this enlarged picture, only show only points. Enlarged picture. Ja. Now you see there are 2 points. One is broncha and second is varanki. These 2 points are used for speech disorder after paralysis and for deaf and dumb. The back point is responsible for language management. When you see some child is speaking but he cannot manage the words, then use back point, Varanki's point. Then in this picture, there is a new point, ZS point. You see the location, ZS point, enlarge some more, show only ZS point. Yeah. More enlarge, no problem. Yeah. Now it is clear. You see ZS point, where is ZS point? ZS point is between lungs, pericardium, small intestine and stomach. This ZS point is very important point for all gynec problems. It is a very good point for all the gynec problems. If you have any ladies patient and she have gynec problem, then you can use this point with first priority, because this is very nice point. And it in next PPT. You go for 132 number PPT. Yeah. Show here the picture very clearly. For John, yeah, diagnosed John. You see here ZS point diagnosed area. It is very near to clavicle bone, nearby scalene muscles. Between the posterior end of the clavicular division of the sternocleidomastoid muscle and the ST12 acupuncture point. The indications for needling the ZS point are disturbances of the female hormonal system and infertility. Are you understand with this point?
Yes, sir.
Yeah. Then say one gone previous. On previous. Yeah. See here the green dotted point and black dotted point. These points are ZS point. This point is almost located on the area of where coronal suture ends. So it is very important point. So never forget it to use. Then doctor go for please 127. There are some extra points in Yamamoto scalp acupuncture. There are extra points. Those are prevalent and very new. Extra lumbar, foot, shoulder, and gastrocnemius point. Then gastrocnemius muscle is a very important muscle in your leg. Then extra foot point. In this picture you see red point is extra foot point. Then near the ear there is gastrocnemius point. On the corner extra shoulder point. This point is located between the angle of the mandible angle and the mastoid muscle. The indication for needling this point are an inability to internally rotate or horizontally extend the shoulder. It is very good point for if this point is painful and you press it, then the shoulder pain also gone. And this point is very good for frozen shoulder and all shoulder problems. But needle very carefully. Extra lumbar point, this point is located on the mandible, halfway between the angle of the mandible and the center of the chin. The indications for needling this point is lower back pain. When you go for, with this point is between the chin and extra lumbar point. when you go on this point, there is a notch. You find a notch. On that notch, you put needle. This is very good point for back pain. Foot point. This point is located on the zygomatic arch, on the front end edge of the sideburn, side hairline, where it is in. There is this point. The indications of the needling this point are problems of the foot, such as ankle sprain, paralysis, foot drop, and plantar fasciitis. When you have problem in knee pain, if there is problem from backside, then you put needle from side of ear side. When you have frontal knee pain, then put needle anterior to posterior towards the ear. I will tell you on Sunday, no problem. Yin Yang. Now you can see all the points location very easily. Where all the points are located in next PPT. Yeah. Then next. Yeah. Show the both lower points. This is very good point area for hand problems. You see Soleus point. This point is used for finger movements. There are medial and lateral points. The medial point location is kidney 7 and 8, and lateral point is location UB 59. When you use these points, when you have a patient and he cannot make a fist, then you use anterior point, kidney 7 and 8 area point. When you are not able, when the patient is not able to open the fist, open the fingers, then you use lateral point. For finger flexion, you use anterior point. For finger extension, you use posterior lateral point. Finger flexion for medial point, then for extension, you use lateral point. On both legs, that side problem, use opposite side. Then go for next PPT. 133. It's very lengthy. Sure. Yes. You see here the somatotopes of K and J were developed as needling point of YNSA at the same time as the basic point were developed. The difference between the 2 points is the site of action. The site of action of somatotope J is anterior side and the surface of the site of the action somatotope K is posterior side and dorsal surface of the foot. Then you see front side J is responsible for front body problems and K is responsible for posterior. In the same view, when you go for scalp acupuncture, then there is same thing. When I teach you scalp acupuncture, then I teach you again this picture. And this is very important thing to you now all these things. Where A point and B point, between A and B there is foot. Then you can draw this picture accordingly to you. Next. All the same. So thank you all for coming and listening me and bearing me.
Thank you so much, sir. It has been very interesting.
Yeah. If you have any doubt, then please ask and write down your doubts and repeat all the PPTs tomorrow. And on Sunday,